apnea, and I'm going to talk about that. So go ahead.
So we can hear it and see.
The title is The Making of Josh 2.0, and go to the next slide. The topic is the importance of sleep quality from a weight management perspective.
Down here,
Gosh, I can't hear you.
Alright. And again, my name is Joshua Schofield. So it's very nice to meet you guys. Go to the next slide. So about me, the simplest way to explain what I experienced in life is I was born basically symbolically wearing that respirator, meaning I couldn't breathe like a normal person. Go to the next slide. And what I found out recently is after everything that I've been through, at a weight of 135 pounds, I don't snore. So I have tattooed on my chest, 135, I can breathe. So it's interesting, I go above 135 pounds, I start to snore. If I go below 135 pounds, I don't snore. Next slide. So about me, so there's Josh 1.0. 1979 is when I was born, and until 2024, 2025, I go by Josh 2.0. I had lifelong sleep apnea. Like I said, I had the inability to breathe like a normal person. And that was due to a congenital birth defect. Basically, my airway was obstructed my entire life. I would sleep for 10 to 12 hours a night and never get any rest. I joined the Navy in 1997 as a nuclear electrician's mate, and I was attached to submarine NO1, which was built by Admiral Rickover in 1969. It's decommissioned, I believe, in 2008. It was the only deep submergence research vessel that was nuclear powered in the Navy. It was 134 feet long, it had 4 beds, it had a max crew of 13 people. So do the math, figure out how that worked. I was on the support crew. I got to help tow the sub because it couldn't go across the ocean on its own. I was discharged honorably in 2000, but it was due to a unspecific diagnosis of a personality disorder. Basically, I was never resting, so I was never sleeping, so I had a personality disorder. Next slide. This is me 1 year ago. You see the difference? A little bit different, right? I almost died on that, go ahead, I'm sorry, I didn't do the thumbs up, sorry. So, I almost died here. I was 203 pounds, and I had severe sleep apnea, and I had 2 doctors tell me I needed a temporary tracheotomy, October of last year. And I didn't know what to do with that. Next slide. So, what is obstructive sleep apnea? Go ahead. Obstructive sleep apnea is a part or complete closure of the airway during sleep, blocking the flow of air to the lungs and causing breathing to repeatedly start and stop. So you're basically snoring, right? The health risks with obstructive sleep apnea is death. You might not wake up because you're not breathing. High blood pressure. You could have a stroke. You could have heart disease. You could have type 2 diabetes. Or you could have a cognitive decline and possibly dementia because you're not getting oxygen to the brain.
Yeah.
Symptoms of sleep apnea are excessive daytime sleepiness, observed episodes of stop breathing during sleep, so choking, waking during the night, gasping or choking, awakening in the morning with a dry mouth or a sore throat, morning headaches. I call them sleep apnea headaches. You're not getting oxygen to the brain, so the brain doesn't know what to do. Trouble focusing during the day. Mood changes such as depression or being easily upset. High blood pressure and decreased interest in sex. Next slide. This is from an article from a psychiatric magazine, and it talks about sleep apnea and how sleep apnea can mimic a lot of psychiatric disorders like depression, bipolar disorder, PTSD, insomnia, excessive daytime sleepiness, and cognitive impairment. And it talks about how it increased the risk of hypertension, stroke, myocardial infarction, motor vehicle accidents. Untreated sleep apnea can significantly increase the risk of suicidal ideation, even after controlling for depression and substance abuse. So again, your brain is never resting, so basically think of it like you're going crazy. Next slide. So the military diagnosed me with a with a personality disorder on my DD-214. What does that mean? I was discharged in 2000. I was 130 pounds. I hit my head on a pipe at work, and I saw the company nurse, I told her all my problems of depression and things like that, headaches. She said, "You have sleep apnea." That was in 2004. That same year, I had my first surgery called U3P, and it's a rotor-rooter of the mouth. They take out the uvula, the tonsils, the soft palate, all to try to open up the airway. But for me, I had a congenital breathing obstruction because it was at the source of the airway just above the trachea, below the tongue. Next slide. So what I did, I figured all this stuff out on my own. The units on here are millimeters, all right? I started my life out at 2 millimeters. Do you know how big 2 millimeters is? It is the width of a coffee stirrer. That's what I was born with to breathe out of. I had dual jaw surgery in 2007. It opened up to 9 millimeters. To put it in another perspective, normal is the green, 10 millimeters to 15 millimeters. So think of it 100% to 150%. I started life at 20%. Dual jaw surgery got me to 90%. Where did the 50% come from? That came from weight gain since 2007 until now. I was 148.6 pounds when I had dual jaw surgery in 2007. It took 5 plates, 22 screws, 6 doctors, 12 hours, 4 type O blood transfusions to do that procedure. It was a good thing that I was left alive when it was done. Anyways, I gained 50 pounds, 60 pounds between 2007 and 2024, and that closed my airway to 50%. So it didn't open it up, it closed it. Next slide. Good. This is a view of my x-ray. This is my airway. This scale up here is in millimeters. This block is 10 millimeters, so you can see just how narrow that block does not line up with this. Next slide. Then I had dual jaw surgery. So here are the plates I talked about. I've got 4 plates here, I've got 1 plate in my chin. I have 22 screws all throughout my jaw. But look at the difference between the two. Do you see the difference in the airway part, the black part? So this got me to 9 millimeters. This is 90%. This is 20%. Next slide. Then life happened, and now I'm at 5.6 millimeters right here. This is the trachea here. My airway closed to 50% because I got fat.
Unknown caller.
What this right here is, this is a wire that shocks my tongue to make it protrude so I don't choke on it when I'm sleeping. The problem with that, it's called a hypoglossal nerve stimulator. The problem with it is that it didn't treat the root cause of my airway. Because my obstruction's down here, it's not up here where my tongue is. Next slide. So what happened? Number one, I'm allergic to everything. I'm allergic to trees, grass, mice, dogs, I have 2 dogs. I'm allergic to cockroaches. And horse, I'm allergic to horse. The VA did testing on me, and that's what they said I'm allergic to. So I'm on this medication called Dupixent. Dupixent prevents nasal polyps from forming up in the sinus cavity. And then I do this Navage. Navage rinses out my sinuses. It goes in one side, comes out the other. It's forced saline rinse, right? And then I started this medication, this magic medication called Zepbound. Zepbound is what they call a GLP-1. It is a weight loss medication, and I inject it once a week. Dupixent I inject every 2 weeks. Zepbound was FDA approved as the only medication to treat sleep apnea. All the other things that you hear, CPAP, you might be on a CPAP, that just blows air, opens it up, dries your mouth out, not fun to wear, all that good stuff. But Zepbound is a weight loss drug. It allowed me to lose 70 pounds. Next slide. So this is, hit it again. This is a video. It's going to show, this is my sinus, this is my airway. This is 203 pounds, this is 135 pounds. Sinus surgery opened that up, and weight loss opened up my airway. Do you see the difference? Next slide. I take sleep very seriously. I have cataloged all of my sleep data since 2018. I went through, I have a spreadsheet that I made that I started in 2021 when I started tracking this. And what we're looking at, the scale on the left is percent. The scale on the bottom is time. So 2021 to now. The green line is weight. And what I did was I normalized it from 130 pounds is the bottom, 0%, 203 pounds is the 100% top. The gray are my steps, how many steps I do a day. So this is normalized from a minimum of 303 steps in one day. The day I had sinus surgery last year was the day I did 303 steps. And then it goes to a maximum of 32,376 steps. So my scale is 0%, 100% is 32,000 steps. So if you follow the gray line, you can see how it starts to go up tremendously. If you follow the green line, you can see the green line is my weight. It drops very rapidly. The blue line is the most interesting. This is my snore percentage. So I've taken how many hours I snore a night, and I've compared it to how many hours I was asleep for that night, and I created a percentage. So it looks like I'm okay over here. I'm in the 15, 20, 25, 30%, but I've had some jumps where it goes to 85% or almost 100%. Well, I had a hypoglossal stimulator put in, and then right here, this area right here, I'm 60 to 100%. They took out this hypoglossal nerve stimulator, and then they put in, on that same day, they put in a new one. You see the gap right here, how it got low? That's because my tongue was not the obstruction. It started to spike again. That's when they activated my implant. And I was back near 80%, 90%. But in this area, this is where all the weird stuff happens. I developed narcolepsy. You guys know what narcolepsy is? Or know somebody that has narcolepsy? If I say something, you say something, I say something, and then I pass out asleep right in front of you. It is uncontrolled. It is very dangerous. But the snoring percentage drops significantly from 100% to 10%. Next slide. This is how much weight I lost. That's my old belt. What's cool is I don't have stretch marks. I don't have any of that. It's literally, that medication took all that fat away. And I don't know how it did it. Next page. And curing sleep apnea, go ahead. It cured my narcolepsy. It cured my high blood pressure. It cured my high cholesterol. It cured GERD, which is your acid reflux. Next slide. My fear of heights. It cured my fear of heights. I think what happened was all this weight loss that happened rapidly controlled basically reset my body's equilibrium. So now I can balance. Next slide. It cured my vitamin D3 deficiency. I was on pills for all these things. Next slide. Back pain. The VA 2 years ago gave me a cane and basically said, here you go, good luck. Next slide. I also had hand pain that was starting to develop because all that fat was pinching on all my nerves in my hands. Next slide. I had chronic yawning. I would yawn. I would be known as the yawner. I just yawned all the time, and it's very contagious. Everybody else would yawn when I yawn. Next slide. And then the VA diagnosed me because they couldn't figure out what was wrong with me. They diagnosed me bipolar in 2012, which is a lifelong condition. But what's interesting is the weight loss removed that bipolar diagnosis last year. I was never bipolar. But what's interesting is they treated me for bipolar for 12 years, which means they put me on all of the bipolar psychiatric medications. They let me go toxic on a medication called lithium. I had to call poison control. Next slide. What it did, weight loss did for me is, next one, it greatly improved my depression. Next one, it greatly improved my anxiety. And the most important, it greatly improved my mobility. Next slide. This is a chart showing how much it improved my mobility. This is my running workouts. April 19th of this year, I did my first run, and I logged an Apple Watch achievement for my first run in over 10 years. So in the military, the requirement was to run 1.5 miles. That was all the lung capacity I had to run that 1.5 miles. I couldn't go further. And I had no idea that I couldn't go further, and I had no idea that I had an obstruction. I have run 226 miles since April 19th. That's 4 months. This morning, I ran 7.86 miles in 1.5 hours. Next slide. These are all the achievements that I made. This silver achievement says first running workout, April 19th, 2025. I got up off the couch when I realized how much weight I lost, and I said, I'm gonna go for a run. But since then, I've done 6 5Ks. I've done 20 10Ks. I've done 3 half marathons. My fastest 10K workout was 1 hour and 3 minutes. My fastest 5K run was this past Saturday at an official 5K run in Huntsville. I did it in 27 minutes. My longest recording workout was 1,348 calories. I ran 15 miles that day. My longest running workout was 15.03 miles. My fastest half marathon was just under 2.5 hours. I'm running a full marathon this December. I never had that in my radar. Next slide. Good. How did I figure all this out? Did the doctors figure this out? What happened? Next slide. My depression was so bad that none of the psychiatric medicines were working, and I found out that there's a medication called ketamine. And ketamine is, do you know what ketamine is? It's a horse tranquilizer, right? They use it to put horses to sleep. But it's also used for depression. It's also used for PTSD. So I started using ketamine clinically about 4 years ago. First with Spravato, which was a nasal spray, And then with IV ketamine, because the VA refused to pay for Spravato, and then they came back and said, we'll give you IV ketamine, it's not FDA approved. And by the way, this shirt says, I beat sleep apnea, I can breathe. I designed the shirt, I designed the hat. Next slide. So ketamine, it's used for treatment-resistant depression, or in my case, extreme sleep deprivation. It allows me to disassociate from my body. It can make me appear asleep clinically, but I'm wide awake. And I've done years of this treatment, basically weekly, to try to figure out what's wrong with me. Next slide. This is what IV ketamine treatment looks like for me. I sit in a comfy chair for an hour. I have noise-canceling headphones in, and I wear a blackout mask, so I can't see. Next slide. And during that treatment, it'll actually not log me as taking a nap. I will hit all these stages of sleep, but I'm wide awake. It's very weird to describe. Next slide. I listened to a song for this whole treatment, and for the past 4 years, it's been the same song. And the reason is because I can't tell time when I'm high. And the VA is paying for me to get high. It's an interesting thing. This is the song I listen to. It's JVNA. It is electronic dance music. So and it goes for a full hour, but the messages in the song are of hope. They're of love. They're of all this stuff. So all of this is getting reinforced into my brain when I'm high. Next slide. Before my weight loss, go ahead, I experienced the wall. I would trip. I would come up to this giant wall. I created this using artificial intelligence. The hieroglyphs weren't there, but it was very similar to this wall. The point is, I was on a desert. It was a desert, it was vast. The wall was infinite, and there was a ceiling. There was no sky, there was no sun. I would come up on this wall every single treatment, and I had no idea why or what it meant. I went through the weight loss, and I kept doing these treatments. The wall disappeared. So I talked to a doctor about it recently, and he said, basically, I removed the obstruction from my body. That's why the wall disappeared. The wall was the obstruction. Next slide. The burp. Every treatment, I would burp at a certain point of the treatment. Just one burp. I couldn't figure out what that meant. I didn't know why I was doing it. I went through the weight loss. I don't burp during treatment anymore. So that went away. Just signs. Next slide. This will blow your mind. That's what that flame was. Ketamine rewires the brain. So it focuses on your neuroplasticity is what they call it. And basically it rewires the brain, it changes the thinking, and it activates the internal body's emergency response system. That's why I saw the wall, that's why I was burping. It is basically doing what doctors couldn't figure out, and it said, I have something critically wrong with me. I need to get it fixed. Next slide. So, go back. So, I enabled, so I had to go, go one more slide, sorry. The fights. Go ahead. So before I talk about that, so ketamine was so important, so to my health that I had to file a White House complaint with the VA. I had to go call the VA White House hotline and say, they're taking away Spravato, I lost my job, I need ketamine treatment to survive because it was the only medication that was helping me. And what that did was it opened up this place called Synergy Wellness here in town, and it opened up access for IV ketamine to veterans, that the VA pays veterans to go to these treatments. And it's cool because I know of at least one veteran personally that goes through this, and one of my most recent treatments, there were 4 veterans getting treatment at the same time that I was. So I opened the door for that. And what I'm finding now is weight is a national problem. In the 1930s, we didn't have a weight problem, but now food proportions have gotten out of control. Medications have gotten out of control. The doctors want you on what they call maintenance meds for life, because that's how they make money. That's how the doctors make money, that's how the pharmacies make money, that's how insurance makes money. For sleep apnea, according to the CDC, over 100 million Americans suffer from obesity. Over 20 million of those suffer from severe obesity. All that weight is constricting everything in your body. It's constricting your arteries, it's constricting your airway. My perspective, like I said, we're put on maintenance meds for life with no way out. Food portions are getting larger and larger because we're consuming more and more, and as a consequence, weight gain is potentially killing us. Conventional weight loss is hard and difficult to maintain. But for my example, medications like a GLP-1, specifically Zepbound, which is a trizepatide, which is FDA approved to treat sleep apnea, it can significantly reduce weight in a controlled setting under doctor guidance, which caused me to come off of 9 daily pills and lose 70 pounds in 6 months. To put things in perspective, my daughter here is 70 pounds. That is how much weight I lost. I lost the weight of my daughter. Next slide. The VA is broken up into all of these different colored areas on the map. It's called VISIT. I don't remember what the acronym stands for. Alabama, Georgia, and South Carolina are VISIT 7. Next slide. And then you can do the next one. As of today, according to the VA, in VISIT 7, there's not one veteran on Zepbound. It is not an orderable item. There are no taxpayer dollars available for it. VISIT 8, which is Florida, Puerto Rico, Virgin Islands. Zepbound is available to veterans. So depending on where you live in the country, changes your level of access of care. The VA is supposed to be federal, right? It should be the same everywhere. It is not set up that way. It is broken into this map and different levels of access of care based on where you live. Next slide. Go ahead. So, my hope is I presented 12 pieces of medical evidence to my doctor recently of why I need Zepbound because the VA refused to cover it. I had to get it through private insurance, which wound up dropping it. The VA basically said no. It was up to VA pharmacy, not the doctor. The doctor would write the prescription for Zepbound. The VA pharmacy would say, no, Josh doesn't get this prescription. So they were dictating who gets what. I called the VA White House hotline, and that triggered an investigation, and the VA pharmacy was presented all this evidence. My doctor was on board, the patient advocate was on board, the pharmacy director of the Birmingham VA was on board, and then the pharmacy still said no. But now, the patient advocate was able to file a clinical appeal with the board of the department chair of the Birmingham VA. They're going to look at it from a clinical aspect and decide whether or not Josh deserves to breathe. And they have 45 days to respond to that White House complaint. And what I've done is I've opened the door for ketamine access, as I was saying, in the Huntsville VA with a community care collaboration with Synergy Wellness, using the VA White House hotline. Area veterans now receiving this benefit to treat PTSD and treatment-resistant depression. Next slide. Final thought, go ahead. What would 1930s America look like today from a food access, weight management perspective? Like 1930s, you didn't have access to the food that we have now. And what if we were our ideal weight and not our pre-labeled BMIs? So basically, for me, 135 pounds is my critical weight. And then, go ahead. And it's documented by Harvard that BMI, body mass index, is not a good health predictor. So, VA telling me, boy, Josh, 19.9 BMI, that's too low. No, that's not a good health indicator. That is a label. And the fight continues. Does anybody have any questions on any of this? Was it interesting? Basically, weight loss saved my life, and I'm trying to enable access to other veterans in the area to have that same level of care. The chaplain that's here, local and based, said basically, I endured 45 years of suffering to get to this point. And now, at 46, I'm Josh 2.0 because I'm experiencing an actual rebirth. I can breathe. What do you guys think? Interesting, huh? Do you guys like the VA?
Something good.
Well, thank you for your time, and thank you for your service. I hope this was informational, and I hope you got something out of this.